My advice for the next president of the United States.
My advice for the next president of the United States is...
My advice for the next president of the United States is that, first off, that we keep the patient protection part of the Affordable Care Act, which has set off a quality revolution in healthcare in America. And secondly, that they start something similar to the Financial Accounting Standards Board that the SEC set up in the past to protect consumers from investment fraud, but to do so for healthcare. So the Affordable Care Act has been much discussed lately, in particular healthcare insurance for all Americans and the difficulties with the exchanges. But what's not been much discussed is the patient protection part of the act. The patient protection part of the act has started a number of different programs, in particular the Hospital Value-Based Purchasing Program, the Hospital Readmissions Reduction Program, and the Medicare Savings Program that tie money to quality. And so as a result of this, today, 30% of Medicare payments are now tied to quality metrics, and it's expected in the next couple years for that to move to 50%. However, there's a crisis brewing, and the crisis is that the quality metrics that are being calculated are inaccurate. And as a consequence of this, we have hospitals that are being penalized that are good hospitals, and we have hospitals that are bad hospitals that are being rewarded. We also have the problem of the patients themselves, because the patients are being directed in some cases to providers that in fact are not providing the best of care. We currently lack national standards for how hospitals should control internally the collection and maintenance of data. And so I've heard of hospitals that, for example, upon the death of a patient, will make sure that things like obesity and diabetes are properly coded, and by doing so have had significant increases in their mortality quality metric. And so what you have are hospitals, some hospitals are investing heavily in these internal controls and are therefore gaming the system, where you have, on the other hand, other hospitals that are not investing in these internal controls quite so much. And even though they look not as good in terms of the quality metrics that are being reported, they in fact have higher quality. And so that's one area where there's an issue. The other issue is in external data integrity. And so some of my collaborators at Rush University Medical Center just published this month an article in the Joint Commission Journal on Quality and Patient Safety, showing that the patient safety indices that are being calculated by U.S. News & World Report in the past have suffered from a data integrity issue. And as a result of that, U.S. News & World Report has actually changed their methodology for how they calculate these scores. The second problem is with methodology. And so a couple years ago, the Institute of Medicine published a report saying that hospitals should begin to collect social and behavioral determinants of health. And it's been well understood that these determinants actually have significant effect on readmissions rates and mortality and other things. And so safety net hospitals in particular, it's felt that they are being unfairly penalized because these determinants are not being accurately captured. And so my second recommendation is that the government should set up essentially a FASB for healthcare. So just like the SEC started the Financial Accounting Standards Board some years ago to protect the consumer from investor fraud, the federal government should start a similar agency, nonprofit, independent, who has two basic roles. One is in setting standards for hospitals, for the internal controls of hospitals around data collection and data integrity. And then they should also be setting standards for external reporting, much like the National Quality Forum does today, for example. But in addition, they should also have audit powers. So they should be able to go into hospitals and verify that the standards that they've set for internal controls are in fact being followed. In addition, any agency, government or non-government, that's involved in rating hospitals should be subject to audit. The quality metrics that they're reporting should be subject to audit to make sure that they're following proper methodological standards and that there's transparency